Scott Weese, University of Guelph, Ontario Veterinary College, and the University's Center for Public Health and Zoonoses. One Health's been the foundation of my work for a while. So I deal with animals and animal diseases, specifically at that human-animal interface. So what diseases can be passed between people and animals and people in both directions, as well as some environmental components of that. But a lot of what we do is looking at the broader concepts of health and how human health and animal health, and to a degree environmental health, intercept, and how we can modify one to maybe have an effect on more than one. From my standpoint, the One Health concept, it's something we've been talking about for a while, but we haven't done very well. We've been very much siloed in our different areas. So with One Health, we're getting a better uptake when looking at animal health and human health and environmental health together. But still within that, we're fairly siloed in our areas of expertise. So we work with disease, and we work with organisms, we work with resistance, but we don't work as much with social behaviors and governance and change and things that can impact that. So one of the issues is looking at the science component, the clinical component, but a lot of it is looking at the behavioral components and things that lead into that. So while we're doing a better job, kind of in my world, thinking about One Health, we're not doing as good a job thinking about multi-disciplines within that One Health. So this network will help us expand One Health by looking at the different compartments, human, animal, and environment. But I think will also let us expand it by approaching it more holistically, looking at disease and looking at the medical aspects and the veterinary aspects and the social aspects and the anthropology and governance and all the other things that need to tie together. Ultimately, it's a very complex problem, and we can't address it with very simple approaches. I think there could be some challenges because I think we've grown up in our own world. So I grew up in the veterinary, clinical, medical world, thinking about disease and microbes and managing those. And it's only been recently I've really started to expand more, thinking about what drives that, the social aspects. And because we haven't really grown up in that world, we don't understand the different specialties. We don't understand the people. We don't even understand the terminology. I think in meetings we get a lot of acronyms that fire around that half the room might understand and half the room is clueless about. And these groups are very important because we can bring together some of that knowledge. I know who to talk to, and I understand a little more of their language and understand what they're doing. And even though I don't understand it to the depth they do, I can feed in some information. And if nothing else, I can raise some issues. So from my side is the animal side, and there's some very complex issues there with animal health and economics and food security and food safety, human-animal bond, a whole range of things that often don't get considered. So one of my components is trying to make sure we're thinking about these in this broad range of social activities and medical activities. So I think the broad approach brings in a lot of opportunities as well, because we tend to attack problems very specifically. And with a complex problem, if we just look at one area, we may not have much of an impact. So looking at the social aspects is really critical because behavioral change is a big component in my world. So I'm looking at trying to get people to use antibiotics differently. And there are various reasons why people don't. And the science and the medicine is one part, and that's easier for me to address. It's harder for me to address the social aspects and some governance aspects that tie in with that. So we need a network like this to be able to get us all together, identify what are the problems, what are the barriers, and what are the multiple ways we can approach these barriers. So by expanding both human, animal, and environment, and expanding both in clinical, medical, social sciences, we can start to come up with better, broader approaches to address some of these very complex problems.